So this is, again, I'm no artist, but we have here our person, the rib cage here, and then we have the pelvis down here. And so we're talking about what the core is. We're gonna relate the core to a can of soda.
Okay.
So think about a can of soda and think about a brand new one hasn't been opened yet. You have the aluminum that is the outside.
Okay.
Inside you have the soda and it's pressurized.
Mm-hmm.
And so everything's closed. If you try to squeeze it, you're not going to compress it very much. It might dent a little bit, but that's it. But the aluminum is helping to contain it, and the pressurization is really helping to keep it there. Mm-hmm. And so our core is going to act very similar to that. And so we're going to relate different parts of the can to different parts of our core here. So this is a pelvic PT's definition of the core generally. So think of the top of the can as your respiratory diaphragm, and think of it as an upside down bowl. So we have our diaphragm there. Think about that as the top of the canister.
Okay.
The bottom of the canister, that's gonna be your pelvic floor. And so that goes from pubic bone back to tailbone and sits in between your sit bones.
Okay.
So think of it as a right side up bowl. And in order to have good core stability, you need your bowls to be over each other. If the bowls start to go oblique to each other, that's going to affect how stable your core is. So that's part of the postural assessments that we do, is trying to find like where is your body happiest there.
Okay.
So that's the top and the bottom of the can. But then we have the cylinder of the can. And so the cylinder of the can is primarily made up of the abdominal wall, but we're highlighting transversus abdominis. Have you heard of that, or TA as some people will call it? And so that the fibers of the TA muscle run horizontally. And so when it contracts, it acts like a corset. And so it should cinch everything in, and that helps to pressurize the canister.
Okay.
There's also another muscle in the back called the multifidus, and so we'll just say that kind of completes the canister.
Got it.
The TA, the actual muscle is only kind of on the side over here, but it has connected tissue that wraps to the front and wraps around to the back to complete the corset. And so think of that as the cylinder part of the can.
Okay.
So now that we've just built the aluminum can part of the core, but now we have to pressurize it. And so we have a certain amount of pressure that we allow into our core in order to help keep us erect and help to keep us stable for the things that we need and love to do. And so for that, think of the can here. You have the top. If you open that top, now everything, all that pressure is free to escape. And so think about, you can squeeze the can, and whether or not there's fluid in it, everything's gonna start coming out.
Mm-hmm.
And so here, think of the opening of the can is up in our glottis. So things like voice is important. So
okay, so here.
Yeah, exactly. So if you're one that finds you hold your breath a lot, so like when you pick your kids up, if you're getting in and out of the car, if you're lifting something heavy, if you find that you're one that holds your breath, or doing Pilates, if there's a really more difficult move, if you're finding yourself holding your breath, then you are trying to rely on pressurizing your canister. And so, which is an important strategy to have, but if we have weakness, like for example, that middle point here, especially after pregnancy, then that weakness can be exploited if we're over pressurizing. And so what's really important is that we are balancing muscle activation with pressurization.
Is this why when you're working out or when you're going to do something, they say like inhale and exhale at certain times?
Yeah. So, and usually our baseline is to say exhale on exertion. And the reason that we say that, and this is, it depends on really what you're doing, because in most of our daily lives, we're not doing something super heavy. We're not Olympic weightlifters. And so if you exhale, that helps you turn on TA, especially that abdominal muscle. It helps lift pressure off your pelvic floor. So you're gonna get more stability underneath here if we're exhaling and we're engaging the aluminum can basically. But there might be times where we do have to limit how much. We might close it partially, or we may have to turn it, like actually close it off. And so although you're gonna hear a lot of people say exhale on exertion, we still have to find out where your body needs it. Sometimes it might be more appropriate to inhale. If I have a patient who actually has a lot of pelvic floor tension, for example, or abdominal wall tension, we might actually need to be doing the reverse. We might be needing to teach everything to expand. And so that's why it's important to have a thorough assessment and not just a blanket, like do this because everybody does it. The other part of the can for our core is that we also have another set of openings. And so we do have openings, depending if you're male or female, how many openings there are, but we do have openings along the bottom. That is another area for pressure to escape. And so for people that are experiencing urinary leakage, difficulty controlling bowel or gas, or what we call pelvic organ prolapse, are you familiar with what that is?
Yes.
Yeah, so pelvic organs, bladder, rectum, uterus, they can all start to descend in their place, mainly because there has been some disruption to their fascia or ligamentous system. But it can also, a lot of it can be driven by pressure. And so if things are descending in the pelvis, or if things are leaking when they're not supposed to, it might be because the pelvic floor is not closing these openings. If you are holding your breath, if you've closed your glottis up here, there's kind of this automatic reaction to, if this closes, down here will close too. And so this is another thing, kind of a tangent on why we often will work with women before they deliver. We want people to like breathe the baby out and not to do too much of that closing off the glottis and just pushing. There's a time and place for it, and we got to listen to our professionals and the people with us at that moment. But a lot of us pelvic PTs are starting to really train people on lots of different pushing techniques, because it can, if we're holding our throat closed and then bearing down, you might actually be squeezing your pelvic floor closed, which then means you have to push even harder, and then that puts you at more risk. So
from babies, well, when you have your first baby, you don't know what you're doing, obviously. Second baby was easier, and the third baby was easiest, but because I think you now know, you're like, oh, I actually shouldn't be like, you should just you know?
Exactly.
It becomes a little more natural with each kid. That you want to like relax and breathe it out versus tense up.
Exactly. And even with people suffering from constipation, it's kind of the same thing. You don't always want to close your glottis off, because if you are trying to bear down, you might be closing things off, and that's going to make it even harder. And then that can cause other problems like hemorrhoids, for example, or other hernias. And so those are examples of core pressure management in the core, is things like pelvic organ prolapse, urinary incontinence. You have poor pressure management, and your weakness is in your abdominal wall. It could look like diastasis. It could cause a hernia, like an inguinal hernia, umbilical hernia. You can herniate up in your diaphragm, and then herniated discs can be a pressure management problem. Not always, but sometimes. And so it's about looking at how all the pressure is managed there. So you does this make sense in terms of like what the core looks like and how it's pressurized, and then the canister? And so when I'm doing my assessments, I need to look at all these areas. We need to look at breathing, we need to look at core, and posture, so we know, is our canister even in the right place? Remember how that was your upside down bowl here? So it affects your pelvic floor down here. And so that's why they need to be stacked on top of each other for good function together. When we inhale, our diaphragm goes from being that bowl, it contracts and it flattens, and that sends pressure down, which will help your pelvic floor relax and do what we call lengthen. So lengthening the pelvic floor is important for things like childbirth, having a bowel movement. And then if you exhale and your diaphragm then lifts up, that's going to release that pressure. So that's going to allow your, that's when it's usually easier for your pelvic floor then to contract and engage. And so they have this relationship where they work together like this. So it's really important to understand how somebody breathes before we understand exactly what's going on the pelvic floor there. So your pelvic floor is made of 3 layers. I'm not going to go through all the details about them, but it has several functions. It's going to help you with continence, and so it's going to close off the openings to help nothing come out. It helps with sexual appreciation. The first layer of the pelvic floor is going to help with just that arousal and blood flow. The second layer of the pelvic floor is where you're going to find the little sphincter that helps you with your urinary control. There's also a muscle that goes around both the vaginal and urethral opening to help just close off those openings. You have your external anal sphincter is another one. There's also both the anus and the urethra have an external sphincter and an internal sphincter. The external ones we can contract if we think about it. The internal ones are smooth muscles, so they are not under our control. They are under our deep nervous system's control. And then we have the bigger pelvic floor down here, which is the third layer, and it's going to give you a lot of that support from underneath. And it's going to help a lot with continence in that it helps to lift the bladder and lift the rectum. And then it will, when it contracts, there's this certain muscle that acts like a hook, and it hooks the rectum, so that way if it's hooked, things can't pass as easily. And that's one reason why a lot of people use squatty potties, and I don't know if you've heard of that before. Yeah. So it's because that when our legs are up in that position, it helps relax these muscles more to help unkink that muscle and to have a better, easier bowel movement. But your pelvic floor is attached to a hip muscle, and so it's also really important that we assess your hips. Okay. And so that's part of the assessment as well. But like if you're standing at the grocery store for a long time, like in line, how would you be standing? What's your natural, like I think we all kind of have.
I do this.
Yeah. Do you feel like it's always that side? No. So it could change.
Whatever.
Okay. Yeah. That's it, and that's fine. So go ahead, go back to the other one. I'm just curious. That's definitely your mommy hip, right? Is that one? Because you can like get it out a lot farther than you do on this side. And so we just want to like be looking, especially in the back on your right side. Your pelvis is now tipping this direction. Yeah. And so your leg is still going to connect to the floor, but that's going to stretch out these muscles over here. It's going to shorten the inner thigh muscles. This side, now these muscles aren't as engaged on the side, but inner thigh muscles are now more stretched out. And so sometimes if we see people that are always using the same side, we're going to see those imbalances of just in the hips, like a weaker hips and tighter inner thighs there. But actually pull your ponytail forward for me, thank you. And I'm just gonna feel your hips. Give me a little march in place. I just wanna make sure you kind of fall into a natural position and then just stop there. And I'm gonna feel your hips here to see if they are level. And just looking here, they look level from there, but I also have to look down at your legs because sometimes we change our knee position based on that. Your right knee looks like it goes a lot straighter, almost like it locks out a little bit more than your left knee. Does that feel like, does that ring true in what you feel in your body?
I don't know. I don't think I've ever noted.
Yeah, that's okay. That's okay. And so just bend this knee a smidge. Yeah. And then right about there. Yep. And then I just want to see if that changed your pelvis a little bit. Just a smidge. And then looking up above. And so, is it okay if we just kind of fold this part of your bra up? Yeah. Just so I can see the curve of your back a little bit more? Yeah, perfect. That's good. And so I'm just looking to see if that's even there. You have a little curve right there. And that's not something, did your chiropractor ever talk about that? Or look at that?
No, but when I was little and I was going to PT for my knees, they would always tell me that.
I wonder, not knowing exactly like what needed to happen at your knees, but sometimes that's where we, the things that are farther away from like the center of our body sometimes suffer. They're the harder ones to accommodate, so that might contribute to that. But yeah, just a little bit of a curve in there, and then at your rib cage here, this side looks tighter than this side. There's just like a little bit of a tilt right there, where this side looks a little tighter than that side. So it might be, I'm getting my sides. This is the side that you can kind of push out more, and so that might be related in there. But what I want to make very clear about all these things is everybody has asymmetries. Nobody is perfectly symmetrical, and so it's only if there's a problem that we necessarily need to fix it. So one thing, I don't want you to come away with this saying like, oh wow, there's so many little things that are imbalanced in my body, that a lot of people are like that. Most everybody are like that. It's just whether or not it's causing a problem. And so I want you now to stand on one foot. It doesn't matter which, we'll do both. We're gonna do it for 10 seconds. 10, and relax. Just that right side. There was just what we call a little bit of hip drop on the left. Now I want you to forward fold like you're trying to touch your toe or your fingertips to the ground. Just go as far as you're comfortable taking it. And so you get a lot of bend up there, not as much in your lumbar spine and a lot in your hips there. And that looks straight. Go ahead and come back up. Does that cause any pain?
No.
Okay, put your hands on your hips and now bend backwards from your waist. And let me know, does that cause any pain?
No, I mean, I can just feel it right here.
Gets a little tight there? Okay, good. And then come back up. Drop your hands to the side. And you're now gonna side bend by running your hand on the outside. Just don't let yourself twist. That's good. And then come up. And then same thing to your left side. Go to the right again. The right side almost just looks harder for you to go into from your back perspective. We look at your spine, and when you go to the left, you get a really nice curve. But when you go to the right, it kind of like doesn't really want to curve. It kind of like wants to, it's like more like fulcruming right here.
Yeah, I can feel it over here.
When you go to the right,
you feel
like
I can feel it over here.
Yeah.
But when I go this way, I don't feel anything.
Okay, all right. The spine can have it has more tension going off to your right side. Now hands cross over the chest. I'm gonna hold your hips and I want you to turn and look to your left. And then come back. And then same thing to the right and come back. Good. And go ahead and bend your knees just for a second. Do a bridge for me. So come, bring your bottom up and then lower it back down. Then bring your legs back down to me. And so this is where a lot of us will just look and see, like, is somebody symmetrical or have a leg length discrepancy. It's not perfect because we don't always know, like, how are the hips up there. But just by looking right now, they're pretty even right there. Here, the knees. I'm gonna feel your hips here. So what's most noticeable with your hip bones here is that this one is just a little higher than this one. So that could be coming from your back, and how I'm suspecting that there's more tension right here in that, in a back muscle called your quadratus lumborum. It's QL is what we often will call it. But that's the one that will get tight with holding a kiddo on a certain side. Here, it almost looks like this side is just a smidge higher. And that might be related to that possible little curve there is in your back. It just might be kind of picking up one side. Now let's do breathing, and then we'll move down into core. So just normal, quiet breathing. Now start to do some deeper breathing. You ever use breathing as a way to relax or?
Yes.
Yeah. Have you learned different techniques, like diaphragmatic, box breathing, like different?
Yeah, box breathing, 4-4, not 4-4-4, 4-4-8, I don't know.
Yeah, I know which one you're talking about. What I'm looking for is where you get the most movement in there.
So Crystal has me practice going like filling up the belly, filling up the chest.
So, yeah.
And then letting out the chest, letting out the belly.
Okay, yep.
So. But I have to really think about it. I do it at night.
It's a lot of coordination. And so that is working on the different areas of your body that move. We actually have 3 places, so we're gonna look at one additional place. When we breathe, you're gonna get some abdominal distension, and then, which is what you're doing. If your diaphragm's pushing down, it's adding pressure, and that's pushing your belly out. Your pelvic floor, if you breathe in a certain way, your pelvic floor will even descend, even though you might not realize it. Your ribs, so that's the next place we're gonna look at, is your lateral ribs here. Do they come out? And good. So you have rib cage mobility there. And then so that's another place that we're gonna see if you need to do that more often in addition to what you're already doing here. But how our rib cage is positioned is really important for the whole core. Now, the upper chest, when your chest is moving, that's more, it's an accessory movement, and so that's more when you need that extra oxygen and usually like exercise is gonna be when you start to see people getting like their chest, their neck, their shoulders into the breathing, and so that's usually secondary. When we're trying to relax the nervous system, trying to emphasize diaphragmatic breathing, which is more abdominal and lateral ribs, is generally what we want to try to do is to try to generate more of that movement down below if we're trying to relax. But working on it's still good to be able to do it up here because we need that kind of range of motion for when we're exercising. I'm gonna feel your ribs, and I want you to lift your head and look at your feet. And then lower back down, okay? So what I'm looking for is what do your ribs do? Our ribs come together at an angle under here. At rest, you have a nice 90-degree angle, which is what we want, but as soon as you start to lift, your angle gets wider. So that's telling me your deep core is not holding everything in place. And so that's one thing that we'll want to work on stabilizing and getting that deep core to engage and help to stabilize your ribs. So then that's going to stabilize your diaphragm. So next we'll be looking for separation. Just going to start at your ribs and feel down just below your belly button. You never get pain here, right?
No.
Okay. Yeah, so you start with some tension up here, and then the lower I go, the softer your abdominal wall gets. And so when I have you add the head lift, I'm expecting to still feel some of that. And so far, my mind is saying, okay, we might need to engage the lower a little bit more. And that you might be one that automatically kind of gets the upper abdominal wall going. So I'm gonna have you lift your head, look at your feet again, and I'm gonna see what happens here. So you actually get fairly good tension in there. And the width is not very wide. So this is actually a really good sign. Go ahead and lower back down. So we look for a few things when we're looking at diastasis. One is we're looking for the width of the diastasis. Are you familiar with that term?
Yeah, they told me like 4 fingers with like 3.5.
Okay, well but that was a few years ago, right? And so.
And I subsequently got pregnant 3 times. So
Yeah. Yep. So, but you're right. When you're activating like that, it does not seem super wide, and so that's good. And it's a lot more of what we're paying attention to these days is what kind of tension do you have down through it. So it's not just about how wide it is, but there is connective tissue underneath that's holding those two sides together. And so those two sides, they need to stay together, so we want tension through that. If my fingers just sink right down into your gut basically, then that's a sign that that lower abdominal wall isn't activating very well. And so far, that looked really good. However, the one thing that I want to point out is that you said in Pilates that you do sometimes get that, did you call it the bread loaf? Some people call it the bread loaf look.
Yeah,
or
like this right here.
Okay. So then that, I was gonna say that sometimes we have to challenge it in different positions. When you're just lifting your head a little bit, you got pretty good tension. But as soon as you lift it a lot more, I think what's happening is that rib cage is probably coming apart, your diaphragm's coming down, and it's really pressurizing in here. And that's creating that little appearance of that pushing out is because of pressure. And so I'm gonna have you do it again. I wanna feel if that, with the higher one. It was a better example when you kind of weren't intending to it, but you're getting a little bit, but it's tight. Okay. And so like that is one of the big things, is that it is engaged. And this might be playing into a little bit about what you're saying about your posture, is that you're not feeling like you have to really engage to feel that. And so if you are actively engaging, you get that tension. But when we're just sitting, we don't need to overly tighten here. We've never had to do that before, right? To sit up tall. It's only now that your body is feeling like, in order to stay erect, you need that. So we can train it and help facilitate it back there, but I don't want you to take away that you need to be like holding your abdominal wall tight at all times. That's not helpful when it comes to the core and the pelvic floor, which needs to be very dynamic. We don't want it to end up too tight, and then we can't then loosen it or stretch it. And so it's about balance, but what I want to see is how your core activation changes with different cues. But before we do that, you're gonna do straight leg raises. So just one at a time. You're not doing like a scissor kick. You're just gonna do one and then the other, just a little bit off the table, not very high. Keep your knee as straight as you can. Okay, take your hands, put them on those hip bones in the front. Do that again. Tell me what your hip bones are doing. Are your hips moving as you're switching sides?
Well, that pulls in my back. That one does not. This feels fine, like nothing moved right here. This moves up, this goes that way, and I feel it in my back.
Yeah. Does that like feel heavier too?
Yes.
Yeah, okay. So
I will say, whenever in Pilates they're like, do a single leg bridge, I'm like, absolutely not.
Okay.
Zero chance.
On both sides
on
or
both
just
sides.
Okay. That's really, you have to have good core stability in order to do a single leg bridge.
One, and I'm like, no, all I feel is like my hips pulling, my knees, like it's just I wouldn't do it.
Yeah. So then a lot of it's core. It might also be looking at hips a little bit more, and if your glutes are firing with that, or if you're more prone to using your hamstrings with a bridge, and so because both can kind of do it, but that's helpful. So it is noticeable that also what I see is your pelvis like tilts as or rotates. One side will dip as the other side kind of goes up. And so those are just signs of that deep core, that we need to activate that more. And so let's find out if more abdominal wall activation or more pelvic floor activation helps. And we haven't done pelvic floor assessment, so I don't know exactly which your version of pelvic floor contraction, but for right now, we're just gonna make it simple. So imagine that you are trying to stop the flow of urine and just do a basic Kegel. Do you know that word? And so it should feel like openings are closing and your pelvic floor kind of lifts up a little bit. And then hold that, and then do the leg lift, and let's see if that changes or if you feel better about that. So you still feel that pulling?
I still feel the pulling.
You
Okay,
do stabilize a little bit more.
I'm gonna do it. Okay, I'm gonna go totally relaxed and just lifting the leg. Okay. Now if I like kegel and then lift the leg. Maybe a little
bit.
but not like a big
Okay.
not like a big difference.
Okay. So now what I want you to do is focus on that really low abdomen, like right above the pubic bone, below the belly button, that area there. If you were trying to draw that in gently, not too forcefully, you might feel like you're doing a little kegel as well, and that's okay. Draw that in and then try.
I can't even like feel what that would be.
Okay, exactly. Yeah.
I literally couldn't even.
And that's part of all of this, right?
Like I can activate my kegel. And I can activate like up here.
But the lower section right here. So I'm just gonna feel right here. I'm gonna feel just between your hip bones right here.
Okay.
And relax. And so yeah, you're definitely getting more upper, because what I feel is that when you're doing it, my fingertips are getting pushed up. And that means that the upper is tightening and it's shunting pressure down, and because this isn't strong enough, it's kind of letting it happen. It's that pressure management. So we're gonna try to work more on that really, really low abdominal section.
Okay.
And I want you to almost think of like a zipper. So kind of start with a kegel and then kind of just bring that contraction just up to right here. Don't let it go all the way up here. So just a little bit. Yep. And yeah, when we do TA, it's not an all or nothing thing. It's very mild. The more we contract, the more it is likely gonna. Yeah. So that feels a bit better. You're not pressurizing downward quite as much. So that part is good. And just zip it up to the really, really low abdomen, like right in here. And relax. And again. And relax. Now add the exhale. So as you're drawing in,
like that.
So
it's really hard to feel it. I like literally my brain like can't even feel what's going on right there.
So we just have to like give it a lot of input. And so when you take your inhale, don't inhale too wide or too big. Just do a little inhale and then almost overemphasize the exhale. Like you're drawing it in. Draw in, inhale, relax.
So when I inhale, I'm letting it go.
Yes, for our purposes right now.
So
yes. Just gentle inhale, exhale.
So when I exhale, I'm bringing it together.
Yeah. And so when you do that, I see your body really want to use the middle abdominals, but the lower ones, they're tightening a little bit, but they are not engaging quite the same. And so that's often where we go with the pelvic floor exam to really understand that like pelvic floor TA relationship, because they have connections of fascia between that abdominal wall and the pelvic floor. And I find that there's different places you can contract the pelvic floor. Even though they kind of all go as one, you still can emphasize one side more than the other. And so for this, generally I'm going to emphasize more of the front. And so forgive the analogy, but it works a lot, is as you're exhaling, don't worry so much about the abdomen, but imagine you're trying to pull the labia in to your body and kind of like upward. And see.
As I'm inhaling?
No, sorry, don't worry about the breath so much right now. Just think about activating, like you're trying to draw that up. That's better. You're not getting so much of the upper, you're getting a little bit more of the lower. Does that change your perception of where you're activating?
Yeah, I can kind of mind body connect a little bit more.
Yeah. Do you feel it in this section, or you just feel it where I'm telling you?
a little here. I still
Okay.
feel like I want to go right here.
Yeah, and that's one reason that.
Or I
for
want to
you-
go here, maybe
That's okay.
like here. Like when I think about it, it wants to be here.
Yeah. If it feels like you're trying to pull your hip bones together, that's what we want. That's one of our cues, is hip bones together. So if you're getting
Okay.
some there,
Okay.
then that's good. And it can, the more that it activates over here, then the pull that it's gonna have on the middle is gonna help strengthen that middle. Our body's very reactive to forces and pressure over and over again. Think about a callus. It's because we're always like pushing or rubbing on that same place. It's the same thing in our muscles, that if we're repeating this certain strain on them, it's gonna tell our body you have to get stronger where that pull is. And so even if you're feeling it here, that is gonna help to strengthen that, which I hope will then help with that like awareness of that midpoint right there.
Okay.
But that can take some time. But I think that just so far, this cue for you, almost kind of imagining like the front, like more of the cubic area, does a little bit more for you than thinking about the low abdomen or even a traditional Kegel. So try that. This is where sometimes this takes time, and so we're kind of going jumping ahead here a little bit, but try to hold that contraction and do the straight leg raise again. Tell me if that makes any difference.
Yes, but I feel like I want to also contract my glutes. Like,
Yeah. Probably because it's helping they're trying to help your pelvic floor a little bit. And so this is where, like, this is a lot harder than where I would typically start. This is a good test, but there's more basic versions of this, something to work on.
okay.
But for you, I definitely would not talk about Pilates and positioning. Don't do the tuck. I don't want you to overemphasize the tuck too much. And so more of the neutral spine. I don't know the way that we had I've worked with a PT assistant who's also a Pilates instructor, and she would always have people make a triangle and kind of like heel of hand goes kind of on hip bones, and then your fingertips is more on pubic bone, and it's like you're trying to make those level. And so that's kind of the position of your pelvis that we want you to be in. And so if that's a helpful visual of while you're doing Pilates, then because if you were tilting your pelvis, it's going to change it.
Okay.
So that's one thing that we would want to develop. And in terms of pelvic floor, I typically will do a pelvic floor exam at this point to give us more information on the ability to contract, to see if there's imbalances, because that also can tell us why this side has a harder time than this side.
Okay.
Typically, a pelvic floor exam is a vaginal exam.
Okay.
And there's no speculum. It is just palpation, and I check lots of things, but it usually lasts 3 to 5 minutes.
Okay.
If that is something that you want to go ahead with today, happy to. If we need to move somewhere, happy to. It's ultimately up to you. There are a few other ways to assess it, and the internal assessment is the gold standard. That's going to give us the most information. Doing a external assessment, just looking and just seeing what your activation patterns look like, is another level of it. Doing a clothed assessment where I'm just feeling kind of at your sit bone is another assessment. I don't really get a good idea of the contracting with that one, but I can get a little understanding of pressure into the pelvic floor. And then there's a few other that I'm not going to mention because I don't have the tools for them at this time. But an ultrasound is my favorite way to assess it. And so use ultrasound through the abdomen, and it's a really good way. We can see all those abdominal muscles working.
Wow.
I'm hoping it's going to happen in the next.
That you'll have that?
I'll have it. And so,
Okay.
and it's really helpful because I teach patients what to look for. So we use it as a form of biofeedback. You can look, and then we're really trying to assess different ways. It's not internal, it's usually abdominal, or if we're really doing a lot of pelvic floor, there might be transperineal, but I'm not expecting